Hello, I'm Sarah Key. I'd like to just explain to you briefly what it is that my masterclasses are. There's been lots of interest around the world, I'm delighted to say. I was asked to start my masterclasses by the Prince of Wales in the UK, and I ran my first in 2003 in London, and I've been running them ever since, and it's now 2010. They run now in the UK and in Sydney, and they will be running elsewhere in the world as well. As it is at the moment, it's only the Northern Hemisphere and the Southern Hemisphere in Sydney and in London. We are actually progressing to doing webinars, doing the masterclasses by webinar, which is very exciting. But first of all, I'd just like to explain to you what it is that they are, so that it's easier for you to make up your mind whether you want to come. I guess the reason that I'm interested in doing them is that I feel that I want to hand on the knowledge, and that I'm interested in making some inroads in what it is that is non-specific low back pain of unknown etiology. I'm sure you're aware that the world over, physios are graduating from physiotherapy courses, as they are from as young doctors are from medical school, and still we're told that the cause of simple low back pain is an unknown. I really think that we have to get to grips with what that is, and this is really what the masterclasses are all about. Going back to basics, actually describing the basic fundamental bedrock science of the way the spine works, understanding the anatomy, understanding the physiology, understanding the biomechanics, and those two really should be in the reverse order. So it's really anatomy, biomechanics, physiology, and also the pathophysiology, how pathology creeps in and why that happens, and why why patients develop pain, but more importantly, what it is that we therapists can do about it. I feel that therapy needs to have more science behind it. It needs to be no longer a sort of grab bag of going on a new course and trying a bit of this and a bit of that. I really feel that we have to substantiate what we do with science. And furthermore, I feel that if we understand the science, then it's easier to explain it to ourselves, it's easier to explain it to patients, and it's easier to recruit patients in that process if we, in part, not all the complexities, but if we, in part, explain what it is that they're doing and why they're doing it and how that's going to make a difference. So I quickly want to run through basically what the first stage one, or should I say stage one of the masterclasses involves. First lecture is a review of the anatomy and biomechanics of the lumbar spine, really the way the lumbar spine works, how it's designed to bend, how the penalty, if you like, of being upright is that the bricks at the bottom of the stack are more compressed, but how we really need to bend to be able to pull fluid in to keep the discs hydrated. There's lots of other things too. I'm trying to be simple. The next stage really is the stiff spinal segment, and the next lecture is the stiff spinal segment, and that is really the first stage of spinal breakdown. I talk about the 5 stages of breakdown in my books. This is stage 1. I believe that 90% of the cases that walk through the door of your outpatient department or who walk through the door of your clinic have this problem, and this, I believe, is what low back pain of unknown etiology is all about. I believe that the disc thins, I believe that the outer ligamentous skin of the disc adaptively shortens and becomes pain emitting, and I believe that is the main source of simple low back pain. If the disc eventually thins, especially to the degree to which that one is, then you pass into stage 2 and you develop facet arthropathy. Because the disc is thinner at the front, the facet joints at the back, in what I call the posterior compartment, overrides, and you start getting inflammation of the soft tissues clothing that facet joint. And I go into all the different features of what facet arthropathy, how it's caused, what it feels like to the patient, what it feels like when you're feeling it, how it can be fixed, what needs to be done, how you help, and what the patient has to do. Stage 3 is acute lock back, how other features of stage 1 of the stiff spinal segment predispose to other things happening down the track. And I believe that acute lock back is primarily caused by delay in the action of multifidus, combined with with an under-pressurized disc, so you don't get spring loading of bending, and that in the first few degrees of bending when the spine is not stable, it's easy to get facet locking with whatever goes with that, whether that be meniscoid inclusions or nipping of a synovial membrane. Whatever it is, it's a crisis. That's explained to you, as well as what to do, how to manage the patient, how to stop it developing into chronic facet arthropathy. Stage 4 is prolapsed intervertebral disc, and I explain how disc prolapse is really very rare, although we hear all the time about slip discs, how slip discs have captured our imagination and reigned supreme for nearly 8 decades, how really it's relatively rare, how it really is a catchy name and it's captured our imaginations, but in reality it's actually rare that a disc will not only cause a bulge of the outer annulus here, but will actually fenestrate or rupture completely. It's very recognisable when you are in that syndrome, both parts of that syndrome. It's very recognisable what you have to do, and more to the point, what the patient has to do at home, because this treatment, this syndrome largely needs to be treated by the patient, him or herself. The next stage is the final stage in my 5 stages of breakdown, how all those previous conditions coalescing at a motion segment cause the gradual incompetence of both the disc at the front and the 2 facet joints of the back, what we call the articular triad, and how degenerative change renders them sloppy and incompetent, and so the segment acquires a gradual propensity to shear as the patient bends forward. Again, easily recognisable as a syndrome, and again, a readily recognisable formula to follow in dealing with patients with both acute and chronic instability. Those are the 5 stages of breakdown. Then I go into the various discussions, how important it is to decompress the spine, how I explain how compression is the root cause, that the compression or sustained loading lowers the metabolic activity of discs and actually causes the discs, if you like, to go to sleep, and how whatever's wrong, whether it's vertebral stenosis, whether it's lumbar spondylosis, whether it's facet arthropathy, whether it's instability, all spinal conditions in their management need daily decompression. That's the first discussion. The second discussion is bending or not bending, to bend or not to bend. I illustrate how important it is to bend. It's absolutely vital to bend. The lumbar spine is designed to bend, to put the thinking, doing, clever part of our body at a height where we can be useful. Then we have discussion 3, the importance of posture and leg length, how aberrations in the beautiful S-bend of the spine when viewed from the side alters the load sharing between the front and the back of the lumbar spinal segments, and how important it is that that's recognised during the process of diagnosis and treatment. And number 4 is the trouble with sitting, the biomechanics of sitting, how it's essential that we do sit, but how the discs lose more fluid when we sit because the intradiscal pressures are much greater. But I explain how we mustn't inculcate fear in patients about sitting, but how there's a better way to sit, certainly when you're in pain, and what are the good and bad chairs. After stage 1, there's stage 2, which goes more into the congenital disorders and crisis conditions, much more in the way of palpations, much more in the way of finessing what you're doing with patients using your hands, finessing the way you're using your hands as diagnostic tools, finessing using the heel. I didn't say in the first part that stage 1, of course, has a big element of practical. We actually have a patient that we see me treating and assessing. I actually assess all the treatments, all the spines of the pupils in the class. I get you feeling what I'm feeling so that we can hone up your diagnostic skills. And then I also show you how it is that you use your heel to mobilise a spinal segment. I then get you practicing on each other, and I then actually get you practicing on me using your heel so that I can give you feedback. And the final part of stage 1 is that we do a spinal decompression class where we use my famous back block, and so that you can show your patients what they must do at home.